Dr. Sharda Jain. On behalf of Delhi Gynaecologist Forum, I am pleased to inform you that critical care course in obstetric has been started for the first time in this particular country, and we have already trained 285 gynecologists of this country. 80% of them are the faculty members, but the people who have come from peripheral areas found it equally useful as for the critical care course is concerned. There are same parameters, same vital signs recording, but our interpretation has changed. That how to pick up those 15% cases who can turn high risk at any time and give rise to tremendous maternal morbidity and mortality. We aim at zero maternal mortality. I can assure you that 10 modules of 3 hours are so beautifully planned for you that you don't feel bored at all. Pre-session questionnaire, which is invariably less than 50% answers are given by you, turn almost 100% normal. In 3 hours time, we see the conversion to such beautiful extent, showing thereby that our methodology is very good and it should reach out to every gynecologist who delivers 5 to 10 cases of pregnancy in a year's time. So my request with folded hand is that we have to do a mammoth job of reaching out to 38,000 gynecologists in this country. Please come forward. Always have a feedback from the people who have already done this particular course. Then you will know that what I'm talking about